Hello guys, welcome to my YouTube channel. This is Mridu. Now let's start with head and neck. In head and neck, first we'll be learning about the face. The face is basically it extends superiorly from the hairline and inferiorly till the chin and in between the two auricles. This is the extent of the face. Now, in face, the main thing is facial expressions. So in this video we'll be covering the muscles of facial expressions and what are the unique characteristics of the facial muscles. So when it comes to the characteristics, the facial muscles are inserted into the skin. So these muscles are directly inserted into the skin, hence they are known as panniculus carnosus. And embryologically, how these facial muscles are derived? These muscles are derived from the mesoderm of second pharyngeal arch. This second pharyngeal arch is supplied by facial nerve, which is the seventh cranial nerve. And what are the functions of these muscles? These all muscles which are in the face together, they control the expressions of the face. So they mainly act on three openings: eyes, that is palpebral fissure; nose, that is nostrils; and oral fissure, that is the mouth. So the muscles of facial expressions, they are the muscles which are inserted into the skin, hence they are known as panniculus carnosus. Embryologically, they are derived from the mesoderm of second pharyngeal arch, hence they are supplied by facial nerve. And what are the functions? They control the expressions of the face. They mainly act on three openings, that is eyes, nose and mouth. Now let's see what are the muscles of the face. In this video mainly we'll be covering the main muscles. So the muscles which are acting on the orbit, that is the eyes, they are corrugator supercilii, orbicularis oculi, levator palpebrae superioris. These are the main muscles which act on the opening of eye. Corrugator supercilii, this causes frowning. This is the muscle. This causes frowning. The wrinkles above the eyebrow is caused by corrugator supercilii. Orbicularis oculi, it is a circular muscle which surrounds the eye. This helps in the closure and opening of the eye. And levator palpebrae superioris, this pulls the palpebrae upper. Hence the name levator palpebrae superioris. These are the main muscles that are acting on the opening of the eye. Now let's see the muscles which are acting on the nostril. The first muscle is the procerus, which is this muscle. This causes horizontal wrinkles. Horizontal wrinkles on the nose is caused by procerus. And the next muscle is dilator nares. Dilator nares, which pulls the nares outwards, the nasal opening outwards. And compressor nares, this compresses the opening, which means it closes the opening. And depressor nares, it pulls the nose downwards. These are the functions of these muscles. These are the muscles that are acting on the nasal cavity. Next, there are many muscles which are acting on the oral fissure, that is the mouth. Let's go one by one. Zygomaticus minor and zygomaticus major. These two muscles, these are responsible for smiling and laughing. And levator anguli oris, which pulls the angle of the mouth upward. Levator in the sense pulling upwards, it pulls the angle of the mouth upwards. Depressor anguli oris, this muscle pulls the angle of the mouth downwards. And next is depressor labii inferioris. Labii in the sense lip, depressor in the sense it is pulling downwards. So it pulls the lower lip downwards. That is depressor labii inferioris. Next is mentalis. It is present at the chin. While thinking, this muscle becomes prominent and it forms wrinkles on the chin. That is mentalis. And buccinator, this is the muscle of whistling. Buccinator becomes prominent at the time of whistling. And risorus, when we are pulling the cheeks, lip on both the sides, risorus becomes prominent. And orbicularis oris, this surrounds the mouth. This muscle surrounds the mouth, that is orbicularis oris. Now let's see the actions of the important muscles. Levator labii superioris, which raises, levator in the sense raises upwards, labii superioris. This muscle raises the upper lip. One more will be there. Depressor labii inferioris, which pulls the lip downwards. And mentalis, this protrudes the lower lip and wrinkles the chin. As I previously told, this wrinkles the chin. And buccinator, this is the muscle of whistling, which tightens the cheek and against the teeth. Zygomaticus minor, which raises the upper lip, this becomes prominent at the time of smiling. Zygomaticus major lifts the corners of the mouth upward and outward. While smiling and laughing, this muscle becomes the prominent. And levator anguli oris lifts the corners of mouth upward. Risorus, this retracts corners of the mouth, that is pulling towards the ends. These are the major muscles of facial expressions. These muscles can be asked as a MCQ question. And there is one more muscle which I missed, that is the muscle of the neck, that is platysma, which is the muscle of Orer. These are the major muscles. In this video, we have covered the muscles of important muscles of facial expression. In next video, let's cover what is the nerve supply of this muscles. Thank you for watching this video. For more content, please subscribe and click on the like button.